and millions of dollars doled out as part of the Trump administration's rural health transformation program. Vermont will get more than $195 million. New Hampshire and New York getting more than $200 million. Our healthcare reporter Laura Allman joins us in the studio to break this down. Laura, what do we know?
TIA, the $50 billion initiative, aims to strengthen and modernize healthcare in rural communities across the country. Half the money will be split evenly among other states. The other half will be awarded through a point system based on a set of criteria. Of that second half of discretionary funds, about 20% is based on a state's commitment to specific policy actions. The provision granting states extra points if they agree to implement Trump administration policies has drawn criticism. States will be rescored each year and funds may be clawed back. Vermont's Agency of Human Services will now negotiate final terms with the federal government. After that, we'll find out exactly where the money is going. Vermont's application for the funds proposes investing in community health centers, dialysis and ventilators for nursing homes, and infrastructure upgrades. Our Calvin Cutler digs in deeper tomorrow. Tia?
Laura, thank you. And Governor Phil Scott thanked the Trump administration in response to the award, saying, quote, "This is good news for Vermont. While there are still implementation details to work out, this significant investment will help us build on the good work we've started to make rural health care more affordable."